Choosing a drug. What to know before starting treatment. So 3 factors must be known before starting antimicrobial therapy. 1. The identity of the microorganism causing the infection. 2. The degree of the microorganism's susceptibility or sensitivity to various drugs. And 3. The overall medical condition of the patient. Which one of those is actually known before doctors start antimicrobial therapy today? Yeah, the last one. So the overall medical condition of the patient. That's really all they know. Think about the last time you went to the doctor or had a loved one or a child go to the doctor with an infection. The doctor kind of looks you over and says, yep, it's viral, and sends you home with absolutely nothing. Or if there's like evidence of a bacterial infection, they kind of say, oh, well, that's an ear infection, so let's give you this antibiotic. The doctor has no idea what the identity of the microorganism causing the infection is, nor do they know the degree of the microorganism's susceptibility to various drugs. So they just give a drug without knowing what the microorganism is or if it's even going to work for that specific microorganism. That's a huge problem. We're exposing those microorganisms to drugs that won't even work. And when you expose a microorganism to a drug, you're selecting for resistant strains of that microorganism. The resistant ones are not going to be affected by the drug, but the drug's going to wipe out all of the ones that are susceptible to the drug, leaving the resistant ones. So that's a problem. And then you have repeat infections and they keep coming back because the antibiotics just don't work. Today, it is possible to get the identity of a microorganism and the sensitivity and susceptibility test results within 4 hours. Using this machine called the VITEC system, you can get an identity and sensitivity to antibiotics within 4 hours. Now, of course, there's lab shortages and there's a strong need for more personnel in the laboratory to do these types of tests, so usually there's a waiting period. But if it's something crucial, like a patient that's in surgery and they're open on the table and suffering from sepsis, and you need to know what is causing the problem and what to treat that patient with because they'll die without that information, now we can get that information within 4 hours. So, why aren't we doing this? It's more convenient for a doctor to just prescribe the most commonly used antibiotic for that particular condition. But doctors are contributing to the development of antibiotic resistance, and this needs to stop. So the goal is selective toxicity, and I talked a little bit about this already, but selective toxicity means that you kill the microorganism without harming the host. So it's selectively toxic. It chooses to kill the microorganism, it leaves the host alone. A little bit more about this selective toxicity. And we'll talk about the modes of action of all these different antibiotics, but because this slide's here, I just want to mention it briefly, and then we'll go into more details later. When we want to kill a microorganism, we have to decide which part of the microorganism can we target. So if you think about the stuff that's inside of our cells, we have a plasma membrane, we have endoplasmic reticulum, Golgi apparatus, the nucleus, mitochondria. And if you think about a bacterial cell, well, a bacterial cell doesn't have any of those organelles. The ribosome is smaller, and a lot of them have peptidoglycan in their cell wall. So majority of bacteria are going to have peptidoglycan in their cell wall. So because their ribosome is different, and because they have peptidoglycan, those are good targets for us. But what if we're talking about antifungals? So a fungal cell has all the same organelles as we have because they're eukaryotic organisms. Of course, they have chitin in their cell wall, but can we really target that? So we have to think about what we can target on the fungi that's different from what's going to be in our cells. Developing antifungals is a lot trickier because they have so many of the same cell parts. The ribosome's the same size as ours. They have the same type of organelles. So as we go through here, that's something to keep in mind, that selective toxicity isn't as easy as it sounds. We have to figure out something that we can target on the microorganism that won't be in our own cells, that won't have adverse effects on our health. So categories of major side effects of these drugs: so direct damage to tissues through toxicity, diarrhea, allergic reactions, disruption in the balance of the normal microbial biota. So diarrhea, a lot of times you wipe out the good guys and you have the overgrowth of the bad ones that end up causing the diarrhea. Allergic reactions, a lot of people are allergic to different types of antibiotics, and allergies mean that now we have to find alternative options of antibiotics to treat the patient with. Drugs most often adversely affect the liver, kidneys, GI tract, cardiovascular system, nervous system, respiratory tract, skin, bones, and teeth. Liver, it may be obvious for you if you've taken this in previous classes, but the liver cleans out the toxins from the bloodstream. So that's kind of the major metabolism hub, and that's going to help deal with a lot of the drugs. So if a drug's going to affect any organ, it's usually going to be the liver. The kidneys, so they're going to filter waste out of the bloodstream. So it's another huge target for antibiotics to cause toxicity. So this is a table showing some of our common antimicrobials and the different types of damage that can happen from these. Tetracyclines, for example, they bind to the enamel of teeth, causing a permanent gray to brown discoloration. They cause liver damage in pregnant women, and they cross the placenta and are deposited in fetal bones and teeth. They won't necessarily cause miscarriage, but they could certainly cause deformities for the child.